My name is Greg Sampanera. This is Dr. Steve Ramey. We're here at the Physicians and Surgical Hospital in Monroe, Louisiana. We're going to present a case to you here using a new device. This is an 86-year-old white female with history of peripheral vascular disease, hypertension. She's had carotid stents, bilateral iliac stents. She's been doing well until recently. She started developing a severe right calf claudication with minimal walking. We've done a diagnostic angiogram on her already. Everything was, all her stents in the iliacs were patent, and what we did find was a high-grade stenosis of the distal right superficial femoral artery. The highest point, the tightest lesion being at the obturator canal.
Let's take a look at that, Greg.
There's two lesions here, so we'll probably treat this as one long lesion. The tightest lesion being, as you can see, right at the obturator canal, and then there's a more significant stenosis of a moderate degree, more proximal to that.
And the device that we want to show you today is a new balloon that allows us to get visualization while we do the balloon and stenting.
We've got an anterior grade access, mainly because she does have the bilateral iliac stents and at the ostium, and we didn't want to have to cross over. So we're going to wire the lesion now. We have a woolly wire, and that went across with no problem.
So you can see that distal lesion is occlusive, nearly occlusive. Excellent. So we're going to bring the GPS catheter over, load it on the wire. We're going to hook up, we're using a power injector here. So now we're hooked up to the power injector here and the inflation device here, and so using this stopcock we'll just switch between inflation device and power injection. Okay?
Yep, 6 French sheath.
Okay, we may want to zoom up on the mag up one magnification, please.
This is a 5 by 40 balloon.
So this balloon's a little short. We're going to do several inflations here, correct?
Yes.
Do you want to do an inflation first?
All right, so now you see we're on the balloon. The button's on the balloon.
Mm-hmm.
We've already sucked negative. The balloon's prepped, ready to go. We'll inflate the balloon.
Okay.
See the balloon inflated.
Mm-hmm.
Now we're going to deflate the balloon by sucking negative like you normally do.
Mm-hmm.
We'll pull back.
Dilate the other lesion.
We'll dilate the other lesion, which is probably approximately about around here.
Can we do an injection to demonstrate that?
To demonstrate that, we can see exactly where we need to be. So what we can do is now switch this to the injection side. Turn your stopcock.
So now we're going to do an injection to see if we're at the lesion. He's advanced the Visio valve so that we're in the inject mode. Cindy? So it looks like we're a little distal, doesn't it? So we can just pull back a little bit. Now we're going to inflate the balloon.
So now we're ready. We'll pull back above the lesion and take our post-dill.
Okay, hold on to it so it doesn't move. Good, so that's probably about 3 cc's. That looks good. So that looks like it's pretty much ready to be stented. Greg, I'm a little concerned we may want to actually extend the stent down a little further down below.
Yes, she has a little bit of a
Can
non-destructive.
you go to one less mag? We don't want to end the stent in. Okay, Cindy again? We're injecting through the Visio valve again.
I think we have room of normal tissue just if we just do it right at there at the bone.
Okay, so leave the popliteal alone?
Leave the popliteal alone.
That's fine. This is a self-expanding stent. And what's the length of this?
7 by 150.
So 7 by 150, usually oversized by a millimeter or two. Is that live fluoro?
Live fluoro.
Good.
Using the bone as a landmark there, I think it's a pretty good spot.
Okay. right, we're going to remove the stent delivery system. We'll go back with our GPS balloon. Okay, so now we're going to go back in with the GPS balloon on live fluoro. Now notice there's two markers at the end. One is just tip marker.
One's the tip marker, and the two proximal markers are the balloon.
Okay, so that's 10 atmospheres. So are these going to be coming in longer lengths, Greg?
Yeah, right now they're only in 40 lengths, but they'll be variable size coming soon.
So we're going up to 12 here. A minute. Good. All right. And this is a 5mm balloon?
5 by 40 balloon.
Okay. Now, do we want to pull back a little bit and do
So
an
I'd pull
injection?
back above the stent.
Okay.
Again, we'll switch it from balloon mode to injection mode.
Okay.
Clear our line with the syringe.
So a lot of the patients with vascular disease also have renal disease, and one of the attractive features of this technology is the ability to do a procedure with much less contrast. I'm going to actually just demonstrate with a syringe how little contrast we have to inject. So this is going to be 2 cc's diluted. Okay, you ready, Cindy? That's 2 cc's. Now, to me, it looks like we have a little more work to do distally there, Greg. All right. So the wire's probably causing some of the spasm down there, too. Okay, you want to pre-dilate there first and see what it looks like after pre-dilating?
Sure can.
Fluoro? Yeah, we got tension.
There it goes.
You need to be a little bit further down.
Mm-hmm.
Can you get us a, say, a 6 by 80 stent? Self-expanding stent? Go a little bit further, Greg. That looks pretty normal there. Okay. So now we're on balloon mode. Negative. Unhook here. Take the balloon out. Do you want to do an injection before we?
We can take a picture if you like.
Yeah, let's take a picture. That looks good. So I think one stent will probably do it, Greg. Really just have to dilate from our last stent to the tubular artery, huh?
Yep.
I mean the patella. You're doing great. Help me out there, Greg. All right. All right, this is a, which stent is this?
6 by
You gotta let
60
go and it'll shoot forward.
EV3.
Let go, Greg. Don't hold it.
Perfect.
So we probably don't have to dilate this, but this will give us another chance to show the Gpscath catheter with the distal injection to show what our final result is. So I think it's worth doing. Pay attention. All right, you ready to inflate?
Mm-hmm.
See that? That's 6-8 atmospheres. Okay. So Greg's going to pull back, and we'll switch to the angio mode.
We'll do inflation there.
Okay. Good inflation here. I'll pull back and you can switch.
Okay.
Switch down. Now just pull back to the proximal stent. Switch over modes. Okay, Wilsoni. Beautiful. All right. Do you want to do one more picture of the whole thing?
Yeah, we can pull back in the
Well, move the table.
proximal to the
Okay.
first stent.
And then one less mag. Good. Why don't we take the wire out, huh, Greg?
Can.
Okay. So now we have we have proximal to the stent. The balloon is proximal to the stent. We're going to do an injection here. You can pan a little bit distally if you need to. Okay. Awesome. Good. Can we look at the trifurcation real quick, Laura? So we'll pan down, please. Good. So let's just do one more picture right here. Cindy? All right. So the anterior tibia looks good. Okay. That looks good, Greg. How are we going to close this?
We'll probably reverse or heparin, hold manual pressure.
Okay, doke.
Okay, Steve. Well, I think this was a great case. I think we had a great result. I want to thank you and everyone for allowing us to show this case at TCT.
Thank you. I agree.